so much, Sarge 653.
All right, here we go, Doc.
And
Thanks, Paul.
I think, yes, well, let's just jump into our KUAM News Zoom room where we have standing by it's official, right? The newly retired medical director from public health. Good morning, Dr. Janna Manglona.
Good morning.
Good morning. Can you hear me?
Yeah, we can
Yes.
hear you. We can see you too.
Good morning, sunshine.
Hey, I got to tell you, no tape today, but I have on lipstick, no mask on right now. I'm in my car.
Right.
I haven't had lipstick on in 7 months, but I thought, oh, I got to dress up for Sabrina and Chris and Jason.
And Jason, right.
Thank you.
Thank you, Doc. Wow, so just a crazy turn of events, at least on our part, and talking to you yesterday, it's apparent that a lot of this was going on behind the scenes. And just bring us up to speed. People were talking about your abrupt retirement, but it turns out it wasn't really that abrupt, right?
No, it wasn't abrupt at all. And there's nothing going on at public health. I can squash that too. In fact, if you had asked most of the people last week if anyone were about to retire, they wouldn't have known, because I literally hadn't shared it with people for one reason. It wasn't any other thing than I couldn't quit crying. And I'm going to do it again. I just did it on Patty's show, but we have such an incredible team at public health, and I always had an incredible little unit behind the scenes. People don't realize I've been there 10 years, and we have this wonderful little unit that treats TB and leprosy on island, and it was centered out of a Manila office. We had contact tracers, we had contact investigators. No one knew we existed at all. I was behind a locked door, and the other part of my team was across the hall, and we knew we had a secret engine going on in Guam, and we loved it. We loved our mission. We knew that people didn't know we were there, but we have been trying to prevent infection coming into our islands for decades. And from the level of immigration, they have to go through our department to even join people on island. People don't know that, but I am so glad that my team and the goodness and the smarts that they bring to the team, to the total cause for COVID, has become so front and center. We're not front and center people. We were the hidden treasure in Guam, and then all of a sudden, people were like, "Oh no, we need contact tracers," and we're like, "No, we got them." And we need contact investigators. Nope, we got them. We got this, and we just need more of us, and we got that. But yeah, we've been hidden away, and now the very valuable thing we do for public health is now front and center, and because now it's needed more than ever for the entire island, not just a group of leprosy or TB patients. Right. So now we've been around a while. We're old timers, but my team is just. I had a small team that I couldn't imagine leaving, and now with COVID, the entire island has joined hands as medical providers and as warriors in this march against COVID. So now all of us, this little team I couldn't dream of leaving, now includes hundreds of people that I didn't normally work with. Even you. I mean, one of my thoughts this weekend is like, oh, I've got to talk to Chris and Sabrina and Patty. I've got to let everyone know. But you weren't in my thought a year ago when I started this. I had two people that I was looking at, and in this culture, so much value is placed on family. Linda DeNorsey left. Who was it for? For her father-in-law. He's elderly, and she's almost retired several times and then didn't. But this time, we see these people slipping away. And so when I started this, my father, who was 101, was still alive and doing well, relatively well. It started to dwindle. And my husband is still good, has some medical issues that I help him with. And of course, his providers. But he didn't make it. And when I was starting all this, dengue hit, and then I went to some conferences. Then my father actually did pass away. And then we had the building fire. And then as soon as we got settled in January, after the building fire, we thought we could take a breath, COVID hit. So there's never been a really good time for me to go ahead and finish the mission. And so, no, this has been in process for a while, and I've been around for a long time. But the community just now saw our group and our team out and about because of COVID. So, are you there?
We're just letting you talk,
Yeah.
Doc. Yeah, we're here.
So it's funny. I didn't get to share this on Patty's show, but on the mainland, you won't find a lot of people. Let's just take a big glaring example. Donald Trump's brother just died. It wouldn't be, he didn't stop his presidency. You don't expect him to. But in the islands, I've often seen people step down from what they're doing to take care of loved ones. And that was a bit of a shock to me when I first moved to Saipan, and that people would actually do that, and they didn't believe in nursing homes and that sort of thing.
Right.
And it's a glorious thing, and I love that about the culture. But Linda stepped down to help with family. Josie stepped down to help with family. I'm not stepping down to help with family. I'm retiring. I'm not resigning. I'm retiring. And I'm looking forward to having more time with my husband. I will still be working in some capacity with public health, hopefully in a part-time role. I'll be working with veterans. My husband and I are dedicated to the veterans. He's a retired command sergeant major, and I had 8 years of training with the VA, 10 years, a decade of service with the VA. And so I'll now continue my services through the CBOC for the veterans. And I'm proud to say that. And my husband's so excited that we can join forces on this because he still helps the veterans. Right. He used to be the administrator for Veterans Affairs in 2015 and 16. So it's a new chapter. There's no backstory. It wasn't abrupt. It was delayed because I can't quit crying when I think of not having those people in my life every day. So, and I would have, my tears last year were just for the team that surrounded me, that I lived and breathed. But now the team is huge because of COVID. And now my tears are more plenty. So we have the best team ever. I wouldn't change a thing. I wouldn't change a decision we've made. And I'm sorry, I'm just sort of veering off here because these are things I want to share. Patty asked that. She said, would you change anything? You know, we look at different areas and what they're doing. I wouldn't change a thing. Every area is doing what's best for their area. And we're all following the lead of COVID. And so our response will be different than California. And actually our outcome will be different because, as you can see, our community is rallying and our numbers are now not in triple digits. And that's not us, that's the community. I mean, we did it before and they're doing it again, and we knew they could do it. And look at our numbers. They can't do this in California and maybe not even Hawaii, but look at Guam. We're Guam, we can do this. So it's our response is, and every decision we've made, I wouldn't change one decision because we are led by the march of COVID. When we see it taking a move, we go after it in that direction. We keep trying to get ahead of it and put out the fires it's causing in the way. So, yeah, our response is going to be different than other areas. And I don't fault any other area because we at Public Health and the government on down, we all know that they're reacting to what they're seeing in their individual areas. So we don't fault them at all. And sometimes we adopt some of the things they're doing and thinking they might work here. So, and some things we don't take because we already know it won't work here. But our numbers are looking better thanks to the community. The policies and protocols have not changed, but this is we are all on the front line, and our front line is working.
You know, Dr. Manglona, you talked about the team that you had. You know, I know Chris and I, you know, early on, it's been, 6 months now, we talked about, who are the shining stars, right, in this fight against COVID? And you definitely have been one of those. Well, you've definitely been one of those shining stars, at least for me and Chris.
Well, thank you.
And so tell me about how hard it was for you to break the news to, you know, the group over there at Public Health.
Very difficult. I'm going to get you for this. Very difficult because we all are working so hard. We have the most dedicated team, and I'm not the shining star. I'm the vocal one. I'm the mouthpiece. But I'm telling you what they're doing. And I'm telling you what the governor is doing. I speak for a lot of people and a lot of their efforts. I can't even, you all have no idea the work that goes on. You know, you get home at 10 o'clock at night, and then you'll have a Zoom meeting from 10 till midnight, and then back up at 5 because something new has happened. It would be so much easier if I were leaving a dysfunctional troop. I'm leaving some star warriors from all over. I mean, all down to the person who I say down to, you don't see the guy that's in his vehicle transporting specimens back and forth to the lab just to make these swab and these mass screenings work. If we didn't have him going back and forth, we're paralyzed. It's everybody, all hands on deck, and all the hands are golden. And the hands on the front line in the community, they're golden. Everybody is fighting this. So yes, I'm vocal, but I'm just telling you what they're doing. And every message I deliver is based on data. It's not an op-ed. It's not my opinion. These are facts. These are what we're seeing in the community. And we knew the community could rally again, and they have. Mm-hmm. So we're Guam. We can do this. And we've got to shut it down and get a different strategy on how to move forward. It's going to be this delicate dance of the ship on the wave, you know, how to go with the wave. COVID is ahead of us until we get the long game going with the vaccine. It's going to be around a while. I can't see it just stopping magically, but I think as medical teams come together and get safe vaccines delivered to all areas, that will help. Our team will keep doing what they do, and my chores will fall to different people. As far as the medical directorship, all the lines are blurred. My job a year ago was very well defined. Now, who's medical director? Who's what? Everybody. It's all hands on deck. The titles might change because for months we've been talking about gathering troops to make a bureau for emerging infectious disease, because now we've had swine flu, SARS, Ebola, COVID. You know, now it looks like this might be our new normal, not COVID necessarily, but diseases that may impact our area. So maybe we need an entire division for that, or entire bureau for that. And so we were looking at this, and so there may not be that particular role anymore because COVID has changed the landscape. And the PAG group, we never had a PAG group before, with a physicians advisory group, where we had this marriage between private collaborators and public health and the military. We didn't have that. Obviously, we would pick up the phone, call them, pick up the phone, call them. Now through Zoom, it's one big family now, and everyone's on the same mission. So everything's changing, and we're seeing needs that we didn't see before. You know, when you first have SARS, okay, we made it over the hump. MERS, we made it over the hump. Swine flu, made it over the hump. Now we're realizing the new norm is that we're going to start having more humps. And so now we need to have a team, a SWAT team, not a SWAT team, a SWAT fleet, an entire platoon, because what the new normal isn't COVID. The new normal is that we're going to have these infectious diseases emerging, and we need to stand ready, and our pandemic response will be there all the time, ready to roll.
Doc, where do you? I mean, I know you just heaped a lot of high praise onto the team that will stay back and continue the fight on COVID.
They're amazing.
And
they're amazing.
But I just wonder where we are now. I know we've got some great people, but you know, the resources have always been a question. We just saw last night that public health lab didn't run any samples. We saw the backlog that we had talked about. So that being said, do you think that the team that will continue the fight has all the tools that they need to win this war?
Yes. Now, it may be that It may be that you don't have the tool in your closet right now, but we identify it and we get it. So uh, we we can get what we need. We have a lot of support with the military, with the federal collaborators. So yes, I don't see any problem moving forward with the current status. No, I don't see any problem with that. It hasn't been a problem, and we've had to mobilize a lot of different resources that we didn't probably foresee in February, but we keep moving in this direction if we see we need to, or this direction. It's constant surveillance, looking ahead to see where it's going and what we need to do to shore up for that.
You know, Doc, you said you're vocal. You have been vocal, that especially on this show, and you know you've taken some hits here, and not just here on the show, but in the community, right? And so when you told your staff and your coworkers that you were retiring, what kind of, I guess, advice did you give them in terms of staying the course and, you know, kill the noise of what people are, you know, the criticisms that public health has been receiving? Did you give them any sort of a pep talk or a message to them? Because sometimes it can be, you know.
Everybody's moving forward with their duties. There are so many leaders behind the scenes, and like Nettie, you've seen Annette Uggan. She's got her team doing their thing. Everyone knows that we just march on. And we're looking at my coming back in a part-time role. So Art and I were just talking about that last night, and what capacity and what things we could do, because there's paperwork that goes with that.
Right.
So we were just putting that on the table, because I want to continue helping public health. No, I'm terrible. I couldn't even look at them and tell them. I was talking to some of them yesterday. Every time I would try to tell them, to share with them, it was just too hard. These guys are great, you know, and you don't have to tell public health people to march on. That's what they do. That's what they do. They're so special. I wish the public could really, or the community could really see what goes on behind the scenes, because you would derive comfort. You've got like moms and dads out there fighting for you and risking their lives every day just to keep their families safe and keep your family safe. They're an amazing bunch, but it's not just public health now. Like I said, we have joined forces with everyone, all the private providers, the military, the governor. I mean, I was never in Zoom calls with the governor before. No one knew I existed for 10 years. And we were just quietly doing our little job back in our little locked ward and saving lives that people, even no one knew what we were doing. We were preventing infection coming into Guam for decades. And people, when they come in from through immigration, they come through us, because we've tried to keep that front up for decades, and we're sort of a hidden story. People don't know we exist, but that machine's been in place for decades, probably 35 years, you know, keeping TB and other communicable diseases away from our communities. So the difficulty, geez, if they were mean, nasty people, it would be so easy to do this. But I've delayed. I started it, you know, before Dingy, and tried to do it in time that I could be with my dad. But, you know, he 101 and a half when he passed. My timing was a little bit off. But and then the COVID and the building fire, it's just been one little thing after another that our departments had to deal with. But this is an island-wide response to this, and most amazing bunch. Linda left, and Art slid right in, and Art is incredible. I've worked with him for years, and he's an incredible leader, and an inspiration. So Linda left big shoes to fill, and Art more than filled them, and the team just has rallied behind him, and we didn't miss a beat. The beats changed even, and we keep changing our response, and the way we function based on what COVID is doing. And, when we had the second wave, you can bet we mobilized more forces and things changed again. And it's okay. That's what we do. That's what we do with infectious diseases. And that's why we're there. So, yes, my little hidden team became front and center because when they found out they needed contact investigators, we got them. We need contact tracers. We've got them. We've been doing this for a while.
Doc, it's not just your team that's going to miss you, right? You've got an entire community out here who have been watching and listening to you for the past several months. Is there any particular message, I guess, you would have for our viewers and listeners?
Right.
Oh, sure. I'm not going anywhere. I'll still be here. I've still got you on speed dial. Are you kidding me? If you think Guam can shut me up, good luck. My husband would like to know how that's going to happen.
Send him the blueprint, right?
Well, Doc, I just wanted to share something because, you said when you moved out to this part of the world, in your work in Saipan and here on Guam, you greatly appreciated the culture and, our sense of family. And,
yes.
And of course, one thing that all Guamanians and people across the Marianas really respect is hard work and also showing gratitude. So I was going to say, when you get home, because you certainly don't want to do this in your car, you might want to have a good supply of tissues and read some of the comments because people are expressing their gratitude for what you've been able to do for our community. Very nice. And I was going to say encapsulated probably best by Chris Cave, who's one of our viewers right now. And he says, Dr. Manglona, girl, let your hair down, wear your lipstick. We're going to miss you.
Wear your lipstick.
Wear your lipstick.
Wear it.
And that's one of hundreds.
Right.
I'm not going anywhere. I'm shifting my efforts. I'll have more time. I will have more time with my husband, which is a big deal. He's my hero. And we'll get to join forces helping the veterans in the community through work at the CBOC, and he still helps veterans on his own. Where our dedication to the veterans is still there despite COVID, and then hopefully I can have a part-time role with public health and still help in some capacity there. Right now it will be with COVID, and my role is changing, and my hours will be a little better, and I'll be able to focus on my priorities at home and still help with COVID and still help with veterans and still help with TB and leprosy. My hours will be a little shifted, which will be better for my family. And I'm not a spring chicken. I know the viewers think I'm 20, but I'm not. I'm a little more than that. I'm 20 and tax. And yes, this is my natural color.
Right,
I'm not
right.
my roots friend.
Mine too. Doc, I mean, just to kind of shift gears a little bit, we had Dr. Jolene Uggan on yesterday, and
Oh, yeah. I love her.
she kind of did, and I was telling Bree, it's like she kind of did the Dr. Manglona interview, but from the GMH side, where it was just serious, it was stern, and I know we're kind of in a place where we're looking back at your service and we're laughing about, the relationship you've had with the team. But I really feel like Dr. Uggan's comments in terms of what she was saying with this virus and how it's more virulent in this second wave, how we've just got so many people who are really sick. I still feel like it's very, very serious. So that being said, I mean, you know, how serious is it?
Oh my goodness. Jolene, I'm thankful to the governor that she allowed this PAG group to form. PAG is the Physicians Advisory Group. What is that group? It's just a few people from the community, a sampling of people and public health, and the military keeps us informed too. They're not actually on the, well, we've got the Guard, but as far as like Naval Hospital, VA, they're not on the table, but they're constantly giving us their feedback. And we have this collaboration that is incredible for the island. Dr. Uggan is on that panel. Yes, that wipes a smile off my face. When people are saying we should reopen and people are judging the decisions made by the governor, we often say when we're off the mic is let them take one walk through Dr. Uggan's world. I can't even imagine seeing 50 people ill enough to be in the hospital and 20% on life support for any illness. That she's down. It's one thing to be doing radio shows in the States when you've got the Vietnam War going on. If you're in the middle of combat, the story changes. She's in the middle of, she's in combat zone. And that'll wipe the smile off your face. It'll break your heart to see what the team is doing and the sick people. And it's not the flu. It is not the flu. When's the last time we had 50 people with the flu in the hospital and 10 of them on the ventilator hanging by a thread, or 12, however many it is? But no, she's in the combat zone. Her message will be totally different because the decisions that they make are to try to save lives. And when the disease overwhelms the patient and the medicines don't work, we're there to help and to save lives. And when you lose one, I can't tell you how personally you take it. Even though we're fighting this formidable enemy, you still don't want to lose anybody, and you don't want to see 50 people lying there sick, and that's 50 people the families can't visit. This culture is so driven on family, and it's I can't imagine the pain that the staff feels on a day-to-day basis, because that's in the belly of the beast. Whole different messaging there, and it's serious business there, and it's heart-wrenching there. I didn't get to hear her interview, and I wanted to, but I'm going to go back and listen to it because we see a few minutes of what she has to say during the PAG group when she's zooming in, but I really want to hear what she has to say on your show, because she had more time to just give you a heartfelt response to that. Usually she's in such a dead run that you can only capture her for a few minutes here and there. So I can't wait to sit and listen to that. I'm glad you reminded me. So
I'll send you the link. I'll send you the link from the link.
I sort of say, can you send me the link to that? Because Dr. Uggan and her team at GMH, they are incredible, and they're on the front line. They're taking their hits. They lost a nurse a couple weeks ago. That's where it's really real, and I people can't go in and see it, but I think it would impact your thoughts about the illness more if you could see it.
Well, thank you so much.
I don't regret any of the decisions. And we're following the lead of the COVID, and we're trying to stay a step ahead, plus trying to address the mess, clean up its mess, and try to stay ahead of it until we can get a vaccine. And that everything we do is to do that. So whatever decision you see that the governor makes, it's based on our feeding her our thoughts as the PAG group, her seeing what her leaders are telling her, and the surgeon cell, and what Dr. Uggan is saying. Everyone, she has to sit there with all the pieces from everyone and try to make decisions that work for the community and our health and safety first. And oh my goodness, it's a difficult, she has to make the big decisions. But I really feel like if everyone in the community could be there and see what all she is having to sort out, and what all we're having to sort out, I don't think anybody would walk away and make a different decision at all. It's it can't be done, I know, but sometimes the bottom line looks bad, but you should see the pieces that went into that. There's a lot going into it, and everyone is just trying to protect the safety and health of the community and our families, and make it a safe place again for the tourists to come. And so I don't know, I could go on and on. My heart breaks when I think about what she's looking at day to day, and when the exposure they're putting their families through, and seeing the exposure to the community. So yeah, she's incredible. Her team is incredible.
Thank you, Doc. And you know, like you said, you're still going to be around, so anytime you want to jump on.
Yes. Oh, you're not going to shut me me up. If you thought this was goodbye, you're crazy. Kadunko.
Well, you got the link.
And again, thank you for the platform that you've given public health. You never knew of Annette Uggan. You didn't know of Chima. You didn't know of me. We didn't. Look at this. I mean, our whole world in Guam has changed, and everyone is in this battle together. Today it's COVID. What is it tomorrow? I don't know. But public health is trying to look ahead and try to change some of the roles and make new roles, like the Bureau of Emerging Infectious Disease was something we tossed out, because this is our new normal. I think is that we're going to have these infections coming our way periodically, and we need to shore up and be ready for the next hit and have our game face on. And it may look just like this because we've done it with COVID. We've done it, but where everyone is mobilized to work with COVID, and we're a unified team, we may be looking at having an entire bureau that does nothing but this. That's their job. So, and that would be a good thing. And I think Taiwan did something like that, or had at least protocols in place to mobilize people to do this type of damage control for viruses.
Right.
All right. Well, thank you so much, Dr. Manglona, for your time, and we wish you the very best. And I know we'll be talking to you soon.
Well, I'll still be helping with COVID, still be helping with TB and leprosy, and helping the veterans through work at the CBOC and compensation and pension exams. And my husband has always been dedicated to veterans, and so we're going to join forces now.
All
Nice.
right.
Yeah, keep us posted, because we know that there's definitely a huge need for the services for the vets. So anything we can do to help to get the word out about anything at all, any outreach or anything with the VA, let us know.
Thank you. And thank you for giving us a voice to get it out to the community, because everyone listens to you all. And then, so when you put us on there and we get to share, it's all good. It's good for you, good for us, good for them. We need you all so much. And thank you. Yes, we've been the hidden SWAT team for years, but now we're at front and center.
All right. Thanks, Doc.
Thank you, Doc.
Talk to you
Thank
soon.
you all.
Exit stage left.
Okay. Okay. Thanks.
Okay, see you.
Okay. Bye.
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 Wash your hands. There's Dr. Janna Manglona, the newly retired medical director for public health. But it kind of sounds like